The defining sensation of next-generation medicine will be its absence. It won't be an object you interact with, a procedure you endure, or a place you visit. Instead, it will become an imperceptible layer of intelligence embedded within the very environment of your daily life. This is the principle of invisible integration, and it represents a fundamental renegotiation of our relationship with healthcare. We are moving from a paradigm of episodic, intrusive intervention to one of continuous, ambient stewardship. The goal is to erase the friction of being monitored, making the collection of health data as effortless and unconscious as breathing. Imagine a world where your health is assessed not by a scheduled blood draw that captures a single moment in time, but by a constellation of silent observers woven into your everyday reality. The bathroom mirror, using advanced spectral analysis, doesn't just show your reflection. It discerns subtle, imperceptible shifts in facial blood flow, heart rate variability, and even certain biomarkers indicative of stress or fatigue. The floor tiles in your kitchen, with embedded biometric sensors, analyze your gait and balance with each step, detecting the earliest, faintest signs of muscular weakness or neurological change long before you or a doctor would ever notice. Your bed linens, threaded with flexible nanotechnology, monitor sleep architecture, respiratory patterns, and core body temperature with a precision that renders the sleep lab obsolete. This continuous stream of data is not a frantic, alarming flood of numbers meant for your daily scrutiny. It is background noise, collected and wirelessly transmitted to a secure, personal health cloud where artificial intelligence acts as a silent guardian. The AI is not looking for a single catastrophic event. It is learning the intricate, unique rhythm of your baseline wellness. It establishes a deeply personal symphony of your normal. Any deviation from that score, a slight, persistent inflammation signature here, a subtle change in cardiac output there, triggers not an alarm, but a gentle, informed inquiry. The technology itself recedes, becoming infrastructure. It is the plumbing of well-being, always on, always working, yet completely unseen. This shifts the patient from a passive recipient of care to an unwitting, yet constant, collaborator in their own health narrative. There is no need for compliance with wearables you must remember to charge or wear. The monitoring is simply there, in the fabric of your world. The profound implication is that it transforms health from a state we periodically check, like a bank balance, into a state that is perpetually and peacefully maintained. Illness in this model is less likely to be a sudden crisis that crashes into your life, and more often a drifting off course that is detected and corrected with gentle, early nudges long before a storm ever appears on the horizon. The drama of medicine fades away, replaced by a quiet, pervasive assurance. Explain of 2 Keynote for 500 words without heading documentary-style words. The future of treatment lies not in the mass-produced vial or the standard dose pill, but in a fundamental reimagining of the very concept of a cure. We are moving beyond the industrial model of medicine, where therapies are designed for the statistical average patient, and entering an age of meticulous, biological, bespoke tailoring. This is hyper-personalization, a shift so profound it renders the term side effects an archaic relic of a less precise era. The blueprint for this revolution is written within us, in the complex code of our DNA, the dynamic expression of our proteins, and the unique, thriving metropolis of microbes within our gut. Medicine will cease to be something you simply take, and become something that is, by its very nature, made for you. Consider the current approach to a disease like cancer. Treatment often begins with a broad-spectrum chemotherapy agent, a pharmacological scorch, turf campaign that attacks rapidly dividing cells, both cancerous and healthy, leading to the devastating collateral damage we know all too well. Contrast this with the emerging paradigm. First, your specific tumor will be sequenced down to its individual mutations, its unique vulnerabilities mapped with exquisite detail. Then, the treatment is engineered. One approach might involve harvesting a sample of your own T cells, the body's natural immune soldiers. These cells are not simply multiplied and reinfused. Instead, they are genetically reprogrammed in a laboratory, their receptors redesigned to recognize and relentlessly hunt the singular fingerprint of your cancer and nothing else. These are not drugs in the traditional sense. They are living drugs, alive and uniquely yours, a permanent, vigilant extension of your own immune system. But this tailoring extends far beyond oncology. For chronic conditions like autoimmune disorders or neurological diseases, the one-size-fits-all pharmaceutical will become obsolete. Instead, advanced biofabrication techniques, such as 3D bioprinting, could use your own cells as the feedstock to create personalized tissue patches or organoids for repair. A medication for your high blood pressure or your arthritis will be formulated based on a real-time analysis of how your liver enzymes metabolize drugs, your kidney function clears them, and your unique cellular receptors respond. The AI that manages your health data will not just monitor you, it will design for you, simulating countless virtual clinical trials on your digital twin to predict the single most effective compound, dose, and delivery schedule for your exclusive biology. This hyper-personalization dismantles the trial and error agony of modern medicine. It turns treatment from a probability into a certainty. The question changes from, will this work for someone like me, to how was this built specifically for me? It acknowledges the breathtaking biological diversity of humanity at the most granular level, honoring the fact that no two bodies are the same in sickness or in health. The factory line ends at the individual. The patient is no longer a passenger on a bus following a fixed route, but the sole occupant of a vehicle whose destination, path, and engine have been custom, built for their journey alone. Explain of 3 Keynote for 500 words without heading documentary-style words. Imagine a fire department that no longer waits for the alarm bell. Instead, its focus shifts to walking through the city, identifying the frayed wiring, the old timber, the spark before it ever meets tinder. This is the essence of the coming shift in medicine, a move from a system brilliantly designed for heroic rescue to one engineered for serene, continuous prevention. The core paradigm will invert. Today, healthcare is a response to a problem you can feel, a pain, a lump, a lab result that has already crossed a threshold. Tomorrow, its primary function will be to analyze the quiet whispers of your body, interpreting the subtlest patterns that foretell a problem you cannot yet sense. This is predictive and preemptive care, and it seeks not to treat disease, but to preserve the state of wellness with such diligence that disease rarely gets a foothold. This predictive power is born from the marriage of two forces: the ocean of personal data gathered by invisible, ambient sensors, and the profound analytical might of artificial intelligence. The AI does not diagnose in the traditional sense. It becomes a master pattern, recognizer of you, by establishing your unique, multidimensional baseline, your personal weather pattern of health. It can detect the slightest atmospheric shift. It isn't looking for the hurricane. It's identifying the drop in barometric pressure and the change in wind direction days before the storm forms. Perhaps it notices a persistent, microscopic rise in inflammatory markers in your sweat, coupled with a faint alteration in your gut microbiome diversity and a slight deviation in your nocturnal heart rhythm. In isolation, each datum is meaningless. Together, they form a signature, a probabilistic forecast that your body is beginning to mount a response that, left unchecked, could crystallize into a specific autoimmune flare or a metabolic disorder 6 or 18 months down the line. The response to this prediction is not a prescription in the old sense. It is a preemptive, precisely calibrated intervention, a micro-correction. This could be a notification to your nutritionist AI to subtly adjust your micronutrient intake via your smart kitchen. It might be a recommendation for a specific, short course of probiotics to rebalance your gut, or a prescribed sequence of biofeedback exercises to modulate your stress response, delivered through your augmented reality glasses. The intervention is deployed at the biological level where the disruption is just beginning, a gentle nudge back to equilibrium long before the condition has a name, a diagnostic code, or a set of debilitating symptoms. This changes the entire emotional and economic architecture of health. The anxiety of waiting for results is replaced by the assurance of constant, silent oversight. The crushing cost of late-stage disease management is bypassed by the minimal cost of early, algorithmic insight and lifestyle modulation. The relationship with our bodies transforms from one of periodic concern, or worse, fear and neglect, to one of continuous, informed partnership. Health ceases to be a destination we arrive at after a cure, or a fleeting state between illnesses. It becomes a dynamic, actively maintained condition, like a garden tended to daily. The goal of medicine is no longer to win a war that has already been declared within you, but to maintain such a proficient and vigilant diplomacy that the war never has cause to begin. Explain of 4 Keynote for 500 words without heading documentary-style words before a pilot ever lifts a modern jetliner into the sky. Its every system, its every response to potential failure has been tested millions of times in a hyperrealistic digital simulation. The first flight is, in a profound sense, not the first at all. This same principle of risk-free experimentation is now converging with the most personal of subjects, the human body. The concept of the digital twin moves far beyond a static medical record or a collection of scans. It is a living, breathing, or more accurately, computing dynamic model of you. It is a virtual copy that ages, reacts, and learns in lockstep with your physical self, fed by a constant stream of data from those invisible, integrated sensors. This twin becomes the ultimate testing ground, a clinical sandbox where the first patient is always the digital one, and failure is not a tragedy but a priceless source of information. Creating this twin begins with a foundational scan of unprecedented depth, a fusion of genomic sequencing, advanced MRI mapping that details tissue density and vascular pathways, and cellular level analyses that populate the model with your biological reality. But this is just the seed. The twin then grows and evolves, ingesting the continuous data stream from your daily life, your real-time vital signs, your metabolic responses to meals, your hormonal fluctuations, even the impact of your sleep quality on your cognitive function. It is not a generic avatar. It is a sophisticated mathematical mirror, its algorithms constantly refined to better reflect the intricate, unique system that is you. The practical power of this proxy is revolutionary. Consider a physician confronting a complex cardiac or arrhythmia. Today, they rely on general studies, educated guesses, and a degree of trial and error with medications. With your digital twin, they can run a simulation. They can digitally introduce a proposed drug and watch, in accelerated time, as its metabolites cascade through your virtual circulatory system, observing its precise effect on your specific heart tissue, its interaction with your unique liver enzymes, and potential side effects on your modeled kidneys. They can test a different dosage or an alternative compound, all within minutes, all with zero risk to you. The applications extend dramatically to procedural planning. Before a neurosurgeon ever makes an incision to remove a delicate brain tumor, they will perform the operation dozens, perhaps hundreds, of times on your digital twin. They will navigate the exact contours of your brain anatomy, practice avoiding your particular arrangement of blood vessels, and test different surgical approaches to find the one that maximizes tumor removal while minimizing impact on critical functions like speech or motor control. The first time the scalpel touches flesh, the procedure will be a familiar rehearsal, not an exploration. This transforms medicine from an artisanal craft, reliant on skill and intuition, into a precision engineering discipline. It allows for the safe exploration of what-if scenarios that would be unthinkable on a living person, accelerating innovation while simultaneously making standard care vastly safer and more predictable. The digital twin thus becomes your most dedicated advocate, enduring every test, every failure, so that you never have to. Explain of 5 Keynote for 500 words without heading documentary-style words for over a century. The hospital has stood as the monolithic cathedral of healing, a centralized fortress where all serious technology resided and where all meaningful care was ultimately delivered. This model is fracturing. The future of medicine is not about building bigger, more advanced citadels, but about dissolving the walls altogether, distributing the power of diagnosis and treatment into the very fabric of community and home. This is decentralized healing, a profound democratization of healthcare that brings the tools to the patient, rather than always bringing the patient to the tools. The hospital of the future will not disappear, but its role will transform from the default stage of care to a vital, specialized hub for only the most acute and complex interventions. The engine of this dispersal is the radical miniaturization and consumerization of medical technology. The bulky $1,000,000 MRI machine remains, but its diagnostic insight is rivaled by a handheld ultrasound probe that connects to a smartphone, providing clinic-grade imaging in a paramedic's kit or a rural doctor's bag. The complex blood test that required a centralized lab and a days-long wait is replaced by a lab-on-a-chip device. A single drop of blood, placed on a credit card-sized disposable slide, can be analyzed at your kitchen table for hundreds of biomarkers, with results streaming to your physician in minutes. Sophisticated diagnostics become as portable and accessible as a paperback book. This shift redefines the geography of care. The most important room for managing chronic conditions like diabetes, heart failure, or hypertension will no longer be the doctor's examination room, but your own living room. Continuous monitors will track your vital data, transmitting it securely to your care team's dashboard. Your regular consultation will happen not through a rushed, in-person visit with its associated travel and waiting, but through a high-fidelity telepresence platform that allows your doctor to see you, talk with you, and review your real-time data with a depth of context an annual checkup could never provide. The clinic visit becomes reserved for moments when physical touch or complex procedure is absolutely necessary. Furthermore, this decentralization empowers a new layer of community-based health. Pharmacies become frontline, diagnostic, and minor treatment centers. School nurses gain access to advanced screening tools. Paramedics in an ambulance can perform and transmit scans to a receiving hospital en route, allowing a surgical team to assemble and prepare before the patient even arrives. This creates a resilient, distributed network of care that is more responsive, less burdensome, and fundamentally more human. It returns a sense of agency and normalcy to the patient, allowing healing to occur within the comfort and context of their daily life, surrounded by the support systems that matter most. The hospital, relieved of routine burdens, can then focus its immense resources and expertise on what it does best, being a pinnacle of advanced, acute medicine, a place for the miracles that still require a fortress. In this future, the system meets you where you are, trusting that the best environment for sustained wellness is often the one you already call home.